Hey everyone, myself Dr. Amit, and today we will going to discuss about introduction to the radiodiagnosis department. So let's talk about it. Radiology represents a branch of medicine that deals with radiant energy in the diagnosis and treatment of diseases by using imaging technologies, or we can say modalities. These fields can be divided into two broad categories, that is the diagnostic one, and second one is interventional radiology. So let's talk about what are the modalities available in our department. So we can use X-ray radiography, ultrasound, computed tomography, nuclear medicine, including positron emission tomography, that is PET scan, and magnetic resonance imaging. So multiple modalities are available. While doing radiological investigations, patient might think that they might have ionizing or radiation exposure. But yes, there are investigations containing ionizing radiations while some investigation don't have ionizing radiation. So investigation containing ionizing radiations are in X-rays, radiography, 3D X-rays, we can say CT scan, contrast X-rays like fluoroscopy, SSG, IVP, ERCP, and in gamma rays used in nuclear medicine, scintigraphy, PET scan, and SPECT scan. Investigations without ionizing radiations are ultrasonography, Doppler, fast scan, that is focused assessment sonography for trauma, and in which MRCP, thermography. So these scans are without ionizing radiations. So we just discussed about there are investigations containing ionizing radiations. So what are the types of radiations? So there can be two types of radiations, particulate radiations and electromagnetic radiations. In particulate radiations, examples are alpha rays, beta rays, and neutrons, while in electromagnetic radiations, the examples are X-ray and gamma rays. Okay, so these are the types of radiations. Now, which radiation is having highest ionizing power? So, alpha rays is having highest ionizing power, while gamma rays is having lowest ionizing power. And what about the penetration power? So alpha rays is having lowest penetration power while neutrons is having highest penetration power. And after neutrons, gamma rays is having highest penetration power. Okay, so this is about ionizing power and penetration power. So let's talk about the X-ray production. So what is the principle? So look over here. Cathode filament is an electron source which produces electron beams. Okay, so here we have our cathode filament. Now anode is a tungsten target which stops electron beams. So here the electron beam travels and here it is stops in the tungsten. Thermionic emission cathode is heated to high temperature which is emit electrons. So here we can see there is a emission of electrons. Anode blocks the beam and 1% of X-rays escape through the window on the film. Remaining 99% of heat dissipated is by radiation. So here we can see that this is the evacuated glass tube and here we have one window from where the X-ray beams are emitted, and this evacuated glass tube is made up of, yes, Pyrex glass or ceramics. Okay, so here we can see that how the X-ray is produced. Majority of anodes are rotatory anodes, which is best suitable than the stationary one. So rotating anode systems can shoot longer and at higher dose. If you intend to perform longer scan like runoff or cross laterals or scan requiring higher dose of larger patients, you will be sending a more lot of electricity into your cathode and a lot more heat to your anode. In this scenario, the superior heat dispersal of rotating anode will serve you well. Okay, so it is better. Now let's look for X-ray tube components. So look over here. Here we have the glass envelope which is made up of lead, and this is the cathode which is made up of tungsten and thorium, while this is the anode and which is made up of, yes, tungsten and rhenium. Focusing cup is made up of nickel. Okay, so this is about the X-ray component. Now look over here. This is the chest X-ray PA view. So look over here, bones appears white. Okay, so bones having maximum attenuation, while air appears black. So air having minimum attenuation, and soft tissues are at different shades of gray depending on their relevant densities. So look over here. Here we have the soft tissue and having the shades of gray. Okay. So it's important to look for AP and lateral view, because if an object is on the skin of the patient, it looks like a nodule inside the lung parenchyma on a view. So look over here, it looks like a nodule. But yeah, in the lateral view, it appears as an object on the skin. Okay, so here we can see that looks like an object on the skin. So hence, two perpendicular views are required to evaluate the exact position of opacity on an X-ray. Okay, this is the importance of, so here we have the importance of two perpendicular views. Okay, now what is fluoroscopy? So fluoroscopy is a video or movie or cine X-ray, and it is used for moving structures like blood in DSA, that is digital subtraction angiography, and it is also used in GIT peristalsis like barium studies and motility cardiology. It is also used in diaphragmatic palsy in paradoxical movement of the diaphragm, and also into C-arm in ortho-OT. Also fluoroscopy used in ERCP, that is endoscopic retrograde cholangiopancreatography. Now let's talk about mammography. So what is mammography? Mammography is an X-ray imaging method used to examine the breast for early detection of cancer and other breast diseases. It is used as both a diagnostic and a screening tool. So look over here. Here we have the image how it is performed. So it has compression plates and breasts are placed on them. X-ray penetrates breast vertically and enter a detector. Compression is must to make better penetration and uniformity of breast. It is contraindicated in mastitis and breast abscess. So generally it is contraindicated in a painful conditions, right? It helps in the early detection of the breast cancer, and it is used more because of its benefit than chest X-ray. So we have two perpendicular views for mammography which are important. So the first one is craniocaudal view and second one is mediolateral oblique view. So in which, look over here, here we have the craniocaudal view. Here we can see the corpus mammae, yeah, also the nipple areolar complex and the Shashignac bursa. While look over here, here we have the mediolateral oblique view, and here we can see this is the pectoralis muscle, and in this view we can also look for the axillary lymphadenopathy. While also look over here, this is the corpus mammae and this is the crest of Duret's. Okay, also this gives a 3D orientation about the pathology. So what is DEXA scan? A DEXA scan is a type of medical imaging test. It is used very low level of X-rays to measure how dense your bones are. So DEXA stand for dual energy X-ray absorptiometry. Okay, and it is helpful in diagnosing osteoporosis. The test is quick and painless. Now let's talk about the basics of CT. So what is CT means? CT means computed tomography. It is a 3D X-ray due to rotating X-ray tube. Images are taken from various angles. So look over here, this is the gantry and this contains X-ray tubes and detectors from where images are taken from the various angles. The table goes in and X-ray tubes rotates around the table. Okay, so this tube rotates around the table. This is the direction of rotation. Okay, and most commonly used CT scan is third generation CT scan. The distance from the table moves for every rotation of the gantry is known as pitch. This is the rotating source and this is the monitorized platform, and pitch is inversely proportional to the quality of the images and the dose of radiation. Okay, so do you know who invented CT scan? Godfrey Hausenfeld. So why we are using CT scan? Is it better than X-ray? So let's discuss about the difference between X-ray and the CT scan. So X-ray is initial mode of investigation which is quick and cheap. while CT scan is choice and best. In X-ray, investigation may be incomplete, and in CT scan, it can give a clear picture of the pathology. X-ray is cheap while CT scan is costly. But yes, because of the clear picture, it is the most of the time it is the investigation of choice. So look over here. So the opacities of a lung cancer patients may look clumsy, but yes, in a cross-sectional view is taken, we can identify the placement of opacities. And look over here, here we have the lung pathologies, and here we can easily identify the placement of the opacities, and that's why CT scan is better than X-ray. In CT scan, bones appear white. Look over here, the bones appears white. Look over here, why this is black? Yes, because of air. So air appears black, okay, jet black. Dirty or less black than the air is fat, while a bit less white, that means acute hemorrhage, or whiter than the bone, so it is metal. It is because of the streaking artifact. Okay, now I just said CT scan is invented by the Godfrey Hausenfeld. So we have Hausenfeld's unit based on the attenuation of the X-ray. It depends on the radiodensity of the substance. So distilled water has 0 HU value, while positive and negative HU values are given based on the density compared with the water. So bones have a high positive HU value, that is about plus 1000 HU value, and air has negative HU value about minus 10,000. Soft tissues having positive HU values about plus 40, while metal have HU values more than bones, that is maximum white. Fat have negative HU value, that is about approx minus 10 to minus 100 HU. Now let's talk about the axial CT and spiral CT. So first let's talk about the axial CT. So axial CT is first to be discovered, and it is invented by, yes, Godfrey Hausenfeld. So the gantry bed moves every time after the rotation of the X-ray tube. The patient and the gantry are not moving simultaneously. It is a time consuming, and movement of the patient may generate artifacts, which makes it difficult to take a radiograph of a single part. Brain CT can be done, but yes, cardiac, lungs and abdo CT is very difficult in axial CT. These scanners have different scanning modes, and the best choice of scanning mode depends upon the clinical task. Okay, so this is about axial CT. Now, what is helical or spiral CT? So, look over here. Here we have the helical CT. So, in helical CT, we can see that there are multiple detector CT. It is used nowadays in sleep ring technology. Both the patient and the gantry moves simultaneously in it, and whole body scan can be done quickly. Okay, so this is about the axial and helical CT. Now let's talk about different types of window in CT scan. So we have three main types of window in chest imaging. So lung window, mediastinal or soft tissue window, and bone window. So in lung window, it is used to visualize the lung parenchyma. So look over here, here we have the lung window, and here we can see the lung parenchyma. In mediastinum window, it is used to visualize soft tissues like the heart and the muscles. Lung parenchyma is not seen here. Okay, so look over here, here we have the mediastinal window. So here we can see the heart, yeah, the soft tissue here. And what is bone window? So it is used to visualize bone pathologies like cortex fracture in axial CT. So look over here, here we have the bones. Okay, so this is the bone window. So these are three different types of windows. Now let's talk about HRCT. HRCT, it is a high resolution computed tomography. It is a type of computed tomography with specific techniques to enhance image resolution. It is used in the diagnosis of various health problems, though most commonly for lung diseases by accessing the lung parenchyma. On the other hand, HRCT of the temporal bone is used to diagnose various middle ear diseases such as otitis media, cholesteatoma, and evaluations after ear operations. So, it can be used for diseases like bronchiectasis, interstitial lung diseases, paranasal sinuses, and for temporal bone fractures, just as we discussed. Okay, so it is the importance of HRCT. But yeah, for your general information, I just wanted to let you know about CT scan has radiation exposure, right? So it can't be used in pregnant women and it is contraindicated in pregnant women. So what is the difference between routine CT and HRCT? In routine CT, we can have the entire section, while in HRCT, it's used for diffuse lung conditions like interstitial lung disease and bronchiectasis and several other conditions. Space occupying lesion can be seen in routine CT, but it is not seen in HRCT. Resolution it is high in HRCT while bit low in CT. The contrast is present in CT scan while in HRCT the contrast is absent. Now, what are the advances in CT imaging? So, let's look over here. Here we have the single source CT and here we have the dual source CT. So, in single source CT, we have fast and poor imaging quality, while in dual source CT, we have fast but yes, improved image quality. So, dual energy CT, in which the principle is chemical decomposition. So it is uses two different X-ray tubes, low KV tubes and high KV tubes. So it is help in identification of radioluminescence stones like uric acid stone seen in gout. Now let's talk about some special CT. So in which the first one is yes CTPA, that is CT pulmonary angiogram. So CT pulmonary angiogram, it is a commonly performed diagnostic examination to exclude pulmonary embolism. Each radiology department will have a slightly different method for achieving the same outcome, that is diagnostic density of main pulmonary artery and its branches. So there are two principles approach for performing CTPA. So the first one is test bolus and the second one is bolus tracking, but I'm not going to in details of these two principles, but yeah, there are two principles, that is the test bolus and bolus tracking. Okay, now here we give the IV contrast and it is a timed scan that is performed when the contrast reaches the pulmonary artery. So look over here, here we have the pulmonary arteries, right, with contrast. Now the next scan is CT cysternography. So it is a minimally invasive imaging technique used to visualize the intracranial CSF systems using iodinated contrast medium injected into the subarachnoid space. So here the lumbar puncture is done in the subarachnoid space, right, in head low position, and it is done in CSF leak suspected patients. So this is the CT cysternography. And what is triple phase CT? So triple phase CT is used in assessment of focal liver lesions, hypervascular liver metastasis, and endocrine tumors. It involves a dedicated late arterial phase, portal venous phase, and delayed phase acquisitions. Hepatocellular carcinoma supplied by hepatic artery rather than the portal vein. So, hepatocellular carcinoma is picked up by the early arterial enhancement in triple phase CT. So, it is useful in the liver lesions. And what is CT guided RFA? So, radiofrequency ablation is used to increase the temperature in lesion and cause necrosis, and it is used in hepatocellular carcinoma and also osteoid osteoma. So, this is about the CT scan. Now, let's talk about the basics of MRI. So, ionizing radiations are not used in MRI, that we all know. Proton, a positively charged particle, is continuously spinning around its own axis and has thus created a magnetic field around itself. This concept is known as nuclear magnetic resonance. Okay, that is nuclear magnetic resonance. So look over here, the protons, that is hydrogen ions in our body, are spinning in a haphazardly fashion and cancel all the magnetism, that is our natural state. When the magnetization is along the longitudinal axis, we cannot measure it. But when the magnetization is along the transverse plane, we can measure it. So look over here, here we have this hydrogen ion and it is spinning haphazardly. But yeah, when we apply the external magnetic field, then it's aligned in a one direction. MRI involves two steps, that is the magnetic machine that aligns the moment and radio frequency pulse that fills the axis of net magnetization vector along the transverse plane. On switching off the radio frequency pulse, transverse movement again goes back to its original state, that is the relaxation state. Now let's talk about spin lattice relaxation or T1 recovery. So look over here, here we can see that the T1 recovery time is time at which 63% of longitudinal magnetization is recovered. So here 63% of magnetization is recovered. So it depends upon the proton and surrounding crystal lattice. While look over here, this is the spin relaxation, or it is also called as T2 decay. So time taken when transverse magnetization reduces to 37% of its original value. And yes, look over here, here it is 37% of its original value, and it depends upon the interspin interaction, right? Now let's talk about the instrumentation. So primary magnetic field averagely used about 1.5 Tesla to 3 Tesla, and radio frequency coils generate the radio frequency signals. Gradient coil defines the plane of image, that is axial, coronal or sagittal. So this is about the instrumentation. So first we have the radio frequency coil, after that there is gradient coil, and at the end there is primary magnetic field. Okay. Now what are the contraindications to MRI? Metallic foreign bodies are contraindications to MRI. Intraocular foreign bodies mostly contraindicated, like pacemakers, cochlear implants, right? There no mobile and credit cards are allowed. Known potential safety concerns due to large static magnetic fields, therefore internal cardiac pacemakers are also not allowed. Steel cerebral aneurysm clips are not allowed. Small steel silvers embedded in eyes, life support equipments with magnetic steel, and stents anywhere in the body are contraindications for MRI. Now let's talk about the spine CT and spine MRI. What is the difference they make? So in spine CT, cortex of the bone best visualized on CT. Therefore, in spine CT, investigation of choice for fractures is always CT, while soft tissue are better visualized on the MRI. Therefore, MRI is investigation of choice for the bone marrow, intervertebral disc, spine or cord pathologies, and also for the ligaments. So this is the difference for spine CT and spine MRI. Now let's talk about the sequences of MRI. So there are three main sequences that we must know in UG. So the T1, T2 and T2 CSF flare. So in which look over here, T1 in which gray matters appears gray, while white matters appears white. So look over here, this is the white matter and it's appear white, while this is the gray matter and it appears gray. In T2, CSFs appear white. So look over here, here we have the cerebrospinal fluid, and this appears white in T2 weighted images. So how can we remember it? Yes, you can remember it by a mnemonic World War II. So in World War II, that is the water white on T2. Okay, so CSF fluid is
white on T2, and T2 CSF flare in which the CSF is not white, okay, but gray matter is white and white matter is darker. Yeah, so in T1 gray matter is gray and white matter is white, while in T2 gray matter is white while white matter is darker. So pathology is more evident when CSF signals is suppressed within the ventricles. So that is flare. I hope I was able to confuse you. Okay, so that's why we will take a bit of sequence exercise. So look over here, what is it? Yes. So here CSF is black, right? And gray matters appears white while white matters appears black. So yes, it is the flare. Now look over here. What you can see? Here we can see that CSF appears white. So it is T2 weightage image. Okay. So this is about the. Now what is diffusion weighted imaging? So this diffusion weighted imaging relies on the concept of Brownian motion. So if a patient is having complaints of stroke or infarct, so what happens? In which the sodium and potassium pumps stop working. That's why the sodium and hydrogen accumulate inside the cells and cell swelling is occurs. That is cytotoxic edema, and there is restriction of the Brownian motion. So in diffusion weighted imaging, there is a diffusion restriction, that is restricted Brownian motion is identified. So it is useful in conditions like stroke, that is ischemia, epidermoid cells, abscess, hypercellular tumors. So in these conditions, diffusion weighted imaging is useful. So here we can see that a well-defined area of high T2 signal with diffusion restriction in the left middle cerebellar artery territory, loss of signal in the left MCA and its branches on the MRI. So look over here we have the middle cerebral artery, and on this left side we can see that a well-defined area of high T2 signals with diffusion restriction here. Okay, so this is about the flare. So this is about the diffusion weighted imaging. So there are few other sequences like STIR, that is short tau inversion sequence, radiant echo sequence or T2 sequence, or also we can say susceptibility flare signals MRI, heavily T2 images of abdomen or HEST sequence, diffusion tensor imaging, which is based on concept of anisotropy, that is to study the white matter tracks. Okay, so it is the preferential diffusion along the neurons, and look over here how it's look like. Okay, so that is the diffusion tensor imaging. So these are some sequences which are useful for UG, and there are many other sequences that we learn in our next videos or sometime if you want. Now, what are the advantages and disadvantages of the MRI? Advantages of MRI includes there is no ionization radiation and no short or long-term effects demonstrated. Variable thickness in any plane, better contrast resolution and tissue discrimination. There may be various sequences to play with to characterize the abnormal tissue, and many details without IV contrast can be taken. So these are the advantages of MRI. So but what are the disadvantages? So disadvantages of MRI are it is time consuming, right? Not easily available. So we have long waiting list, no on-call service because it is time consuming, and need to tweak sequence as per the clinician or clinical questions are evolved, hence cannot be generalized. So these are the disadvantages of MRI. Now let's talk about the basics of ESG. So basics of ESG, in which the first one is, let's talk about the principle. So it is based on the pulse echo principle. Sound waves are generated and passed through the body structure. Yes, depending upon the behavior of particular structure to the sound waves, different kinds of images are obtained. So if the surface reflects the sound wave, that surface appear hyperechoic. Okay, hyperechoic means looks like a white, while if the surface absorbs the sound waves, that surface appears hypoechoic, means it appears black. Okay, and the frequency of sound wave used for ultrasonography is 1 to 20 megahertz, that is the range of diagnostic medical USG. And ultra biomicroscopy and intravascular ultrasound have frequency of more than 20 megahertz. So this is the principle of the ultrasonography, and the terminology we used for ultrasonography are black for hypoechoic, I just said, white for hyperechoic, and if it is completely black as just like the screen, that is the anechoic. Okay, so let's look at the examples. So this is the hypoechoic area, this one is the hyperechoic area, and this is the completely black area which is called as the anechoic. Now, what are the modes used in ultrasound? So there are few modes. Look over here. The first one is B mode, that is the brightness mode. The second one is M mode, that is motion mode. CF means color flow mode. PDI means power Doppler imaging mode. PW means pulse wave Doppler mode, and CW mode means continuous wave Doppler mode. So these are the basics mode used in ultrasonography. Now let's talk about the first thing that we used in hand while doing ultrasonography is ultrasound transducer. So it produces sound waves that bounces off body tissue and makes echoes that we just discussed. Then it receives the echoes and sends them to computer that uses them to create an image called sonogram. So in transducer, piezoelectric crystal is the backbone. These piezoelectric crystals are made up of the lead zirconate titanate. Okay, so this is the acoustic insulation in the probe, while this one is the backing layer, and here we have the piezoelectric crystals. This one is the matching layer, and here we have the acoustic lens. Okay, so this is the ultrasound transducer. So as I said, there is range of 1 to 20 megahertz. So here, look over here. Here we have the different types of probes and their frequencies. So first one is here we have the curvilinear probe and having the frequency of 2 to 5 megahertz, while this one is the linear probe and having the frequency of 5 to 10 megahertz. This one we called it as the TVS probe, that is transvaginal probe, and having frequency of about 3.5 megahertz to 11.5 megahertz. Here we have the phased array probe, and this phased array probe having the frequency of 1 to 5 megahertz. Okay, here we have the microconvex probe, and here the frequency of 5 to 8 megahertz, and this one is the 3D probe and having the frequency of 3 to 9 megahertz. So these are the frequencies and different types of probes that we used in our ultrasonography department. Now look over here. Here we have the transducers, and these are our frequencies of each transducers, and here we have the penetrations. Okay, so higher the frequency, then lower is the penetration, but good resolution. So linear probe is having low penetration but high frequencies and having great resolution, while phased array probe is having deeper penetration but there is low resolution. So higher the frequency, greater the resolution but less penetration. So resolution, or we can say the penetration, is inversely proportional to the resolution. Okay, so now let's talk about indicator position. So in our every probe there is one indicator for the orientation. So standard applications and procedures, the indicator orientation marker position will be on the left side of the screen. Okay, so this is the indicator here which is on the left side, and this is the indicator marker. Now let's talk about posterior acoustic shadowing and posterior acoustic enhancement. What is it? So posterior acoustic shadowing, it is in the 90% of the gallstone are radiolucents. Therefore, investigation of choice for the gallstone is ultrasonography. On ultrasonography, gallstones appears hyperechoic in gallbladder, and posterior acoustic shadowing is a property associated with the calculus. So look over here. Here we have the gallbladder, and here we can see that hyperechoic stone. Okay, so just behind this we can see that there is posterior acoustic shadowing. Yeah, you can see that. Just like this, we can also see posterior acoustic shadowing in the renal stones. Okay, now what is posterior acoustic enhancement? So look over here. Here we have one cyst. Yeah, it is a well-defined cyst, and look over here. Here we have the posterior acoustic enhancement. That is, there is hyperechoic area just posterior to the cyst. That is the posterior acoustic enhancement, right? Now, what is 3D USG? 3D USG, it is a application used for fetal scan and for evaluation of the Mullerian duct anomalies. And yes, it is the investigation of choice for Mullerian duct anomalies. MRI can also be the choice of investigation for Mullerian duct anomalies. And 3D USG can also distinguishes septate and bicornuate uterus. Now, what is USG elastography? USG elastography, it is also called as shear wave elastography, and it is measure stiffness or elasticity of a lesion. Generally, it is used for the breast lesions, while it can use in the thyroid, endometrial masses also. But yeah, it can give the stiffness of the tissue. So harder the tissue, the more it likely to be the malignant. So look over here. Here the upper part is, that is here, it indicated in the red color. So it is the harder mass, while this blue part is the softer mass. So harder the tissue, that is the more it likely to be the malignant. So this is the USG elastography or shear wave elastography. So this is all about the basics of USG, and if you have any doubts you can ask me. Then let's talk about the nuclear medicine. What is nuclear medicine? Nuclear medicine is the imaging involves the administration into the patient of radio pharmaceuticals consisting of substance with affinity for certain body tissue labeled with radioactive tracers. The most commonly used tracers are technetium 99M, iodine 123, iodine 131, gallium 67, indium 111, thallium 201, and fluorodeoxyglucose 18F can be used for tracers. The heart, lung, thyroid, liver, brain, gallbladder, and bones are commonly evaluated for particular conditions using these techniques. While anatomical details is limited in these studies, nuclear medicine is useful in displaying physiological functions. The excretory functions of the kidney, iodine concentrating ability of the thyroid, blood flow to the heart muscles, etc. can be measured by nuclear medicine. So this is all about the basics of an intro about the radiology department and the commonly used radiological modalities. Thanks for watching this video.